Assured Half Hour, the program that takes you through the activities of the Aisha Buhari Foundation. My name is Fatima Ngogo. First, let's take the news. Wife of the President, Aisha Buhari, has joined her counterparts, the spouses of African heads of government, to a regional high-level seminar on cancer awareness and advocacy with the aim of reducing the burden in Africa. State House correspondent Aliu Kabir reports that the seminar took place in Ouagadougou, Burkina Faso, hosted by the First Lady, Sika Kabore.
Records by the World Health Organization, WHO, show that about 840,000 persons are being affected by cancer in Africa annually, and there is the fear that by 2030, the number could reach to 1.4 million, with Nigeria taking its portion. In an attempt to combating the scourge of cancer is what brought together this seminar, which provided an opportunity for the spouses of the African heads of state and government who were members of the Organization of Islamic Countries, IOC, and other critical stakeholders comprising the continental and other international non-governmental organizations such as Islamic Development Bank, IDB, International Atomic Energy Agency, AIEA, African Development Bank, IDB, WHO, and the United Nations Population Fund, UNFPA. Participants have identified factors responsible for the increase of the disease in Africa as lack of awareness of the dangers of the disease and the possible ways of managing it, as well as lack of access to healthcare facility, harmful traditional practices, and poverty, among others. The wife of the president, Aisha Muhammadu Buhari, highlighted the commitment of the government towards addressing the challenge, especially the launching of National Cancer Control Plan, which is all and encompassing in guiding the implementation strategy for cancer control in the country.
We have conducted screening of cervical and breast cancer that has benefited thousands of women across the country. In some states of Nigeria, where we have the first ladies as medical doctors, some are consultants, gynecologists, and pediatricians, we work with them hand in hand as a primary source of advocacy and campaign on cancer.
She described the plan as focal point for both national and international non-governmental organizations to key in with reference to a Future Assured program and the activities of governors' wives.
I'm assured that development partners will take advantage of decisions that will come out of this meeting and chart clear course of action on cancer.
The First Ladies of Côte d'Ivoire, Dominique Ouattara, the Gambia, Fatima Tabaro, Guinea-Bissau, Maria Rosa, Niger, Lala Malika Yusufu, and their host of Burkina Faso, Sika Kabore, and others reaffirmed their commitment to expedite action in tackling this scourge.
It has been a very good experience so far because I think there's a lot of gains from the previous one, and more has been added on with this.
The First Lady have now understood that they need to work collectively as a team. And this will earn them more result in terms of at least when they work together, they will be able to be taken seriously as a united front.
At the end of the seminar, the spouses of the African president, alongside other critical stakeholders, expressed optimism that the deliberations of the conference, if properly adopted, will go a long way in addressing the challenges of cancer within the continent of Africa. In Ouagadougou, Burkina Faso, Aliu Kabir, NTA News.
Wife of the President, Aisha Buhari, says she will continue to support Nigerians, especially women and children, in reducing infectious diseases through her project, Future Assured. The wife of the President said this in Abuja during a courtesy visit by a delegation of the Voice of America, led by the director, Amanda Bennett. Jide Onifade reports.
More than 3 years now, wife of the President, Aisha Muhammadu Buhari, has been rubbing soothing balm on the wounds of Nigerians, especially those with health-related challenges.
We do train like a lot of empowerments going on using my Future Assured program. We did a lot of health screening, a lot of deworming for the pupils in primary schools. Thousands of children and thousands of women have already benefited from my Future Assured initiative.
Apart from the critical role of the media in projecting the activities of the government, as the wife of the president told our guests, the media could also assist in the Future Assured project.
News and programs help people to be conscious of successes and challenges of government and helps to keep government in account. It is equally important for you to emphasize on successes of the government in the part of your social corporate social responsibility in the US, how you can, link up with my Future Assured program to see how you can come into our programs.
We find that women are very much underrepresented in the media, and so we find that women can't do economic and political development if they can't see themselves in the media. So that's one of our goals.
The media has plays important role in every aspect of national development, every aspect of human development. So we cannot underestimate their role. In terms of what Her Excellency is doing, we need a lot of publicity, and she's doing so much under her Future Assured program, both at national and international levels, and I think the media needs to actually sell out most of the things she's doing to the public.
Wife of the president, Aisha Muhammadu Buhari, has been so passionate about the well-being of Nigerians, especially the women and children. From the presidential villa in Abuja, Jide Onifadi, 19 News.
In the quest for supporting the lives of women and children of both Nigeria and the Gambia, wife of the president, Aisha Muhammadu Buhari, hosted her counterpart, the First Lady of Gambia, Fatoumata Barbero, and paid a visit to Maitama District General Hospital in commemoration of the birthday of the Gambian First Lady. State House correspondent Aliu Kabir reports on why the event was celebrated in Abuja, Nigeria.
Sunday, the 5th of August, marked the birthday of the Gambian First Lady Fatoumata Barbero, and she has decided to pay a visit to the Gambian students currently studying in Nigeria in an effort to supporting them and give them words of encouragement for becoming a useful future leaders. She has decided to stop over as a mark of respect to pay a visit to the wife of the president, Aisha Muhammadu Buhari. The duo have concluded to pay a visit to the patients at Maitama District Hospital in commemoration of the birthday, and the first port of call was the emergency pediatric ward. They sympathized with the patients and shared with them their sorrow. Mrs. Buhari and Madam Barrow moved to the general pediatric unit and maternity ward. They present gift items to the patient. While praying for their quick recovery, Hajia Aisha and Madam Barrow assured not only them for their full support at all times, but to the women, children, and other less privileged in their respective countries.
Actually, she visited Nigeria to see the Gambian students that are schooling in Rochas Foundation in Imo, and it coincided with her birthday, so we decided to spend it, to wish her a happy birthday in a small way by visiting the patients in a government hospital.
Alhamdulillah, I'm thanking God for everything, for adding another year on my life, celebrating it in Nigeria in a different way. Thank him very well.
The uniqueness of the celebration was overwhelmed by both the hospital management and the patients, so much so that they could not hide their happiness.
I think it's a great tip on our part. We have to be grateful to the administration too, our First Lady, Aisha Muhammadu Buhari, for bringing her to at least before the patients. They are still, all of them live, and they've got a lot unexpectedly from them.
The event was climaxed with the cutting of the birthday cake in a very low-key atmosphere at the residence. From the State House, Aliu Kabir.
August 1st to 7th every year is observed as World Breastfeeding Day to encourage breastfeeding and improve the health of babies around the world. The theme of this year's World Breastfeeding Week is Breastfeeding, Foundation for Life, a recognition of the importance of breastfeeding to a baby's future. Let's watch some highlights from the 2017 Breastfeeding Week.
Today, particularly, marks another milestone in driving the efforts closer and I wish to request your gracious commitment towards sustaining breastfeeding together in order to ensure Nigeria delivers the maternal, infant, and young child nutrition towards nutrition targets of the Sustainable Development Goals by 2030.
It is an important theme because there is a mounted evidence and consensus among government authorities and the development partners that breastfeeding is an important child health and survival intervention. Sadly, however, 8 out of 10 infants of the age of less than 6 months in Nigeria are still not exclusively breastfed. Children who are not exclusively breastfed are denied the uncontested benefit of breastfeeding, including healthier start in life, reinforced immune system as breast milk provide antibodies, and healthy growth and development. UNICEF called on the government and other stakeholders to strengthen and reinforce the code of marketing of breast milk substitute to protect children. With a collective effort, we can sustain breastfeeding together for a better future of the Nigerian children. I wish the country a successful World Breastfeeding Week.
This annual global campaign is an urgent call to the world populations to the benefits of breastfeeding as the first natural immunization. With this year's theme, Sustaining Breastfeeding Together, Nigeria joins over 170 countries on a platform for long-term partnership of all advocates, activists, decision makers, media, young people, and celebrants for sustainable results. The National Policy on Infant and Young Child Feeding describes exclusive breastfeeding as giving infants only breast milk in the first 6 months of life. No other liquids, no semi-solids or solids, and not even water except oral rehydration solution or drops or syrups of vitamins. This launch of breastfeeding advocacy initiative is aimed at attracting media coverage to the dissemination of 2 new research findings. The first is an investment case for breastfeeding, building upon the World Bank investment framework and including country-level data about the cost of not breastfeeding. And 2, a scorecard assessing country-level progress on reaching the 7 policy recommendations outlined in the Breastfeeding Advocacy Initiative Call to Action to protect, promote, and support breastfeeding with indicators and targets. Your Excellency, the wife of the President of the Federal Republic of Nigeria, Mrs. Aisha Buhari, and the National Nutrition Ambassador, ably represented here, your Future Assured project is supporting the Federal Ministry of Health to achieve the health sector goal in the national socio-economic development, and I sincerely appreciate your esteemed presence to honor us at this day's event.
It is my great pleasure and honor, of course, to represent Her Excellency, the wife of the President, the National Nutrition Ambassador of Nigeria, the national and champion of the Stop TB Partnership, and of course the initiator of the Future Assured program. The benefits of breastfeeding are enormous, including providing babies with the essential nutrients and antibodies that protect them from malnutrition, preventable diseases, and even death. On this note, I also call on employers in Nigeria to create an enabling environment for breastfeeding mothers through the provision of daycare centers, breastfeeding rooms in workplaces, flexible hours, and other practical solutions. Many mothers want to breastfeed for longer than they currently do, and this policy will help them to do it. Finally, as you may be aware, I use my Future Assured program as a platform to play an important role along with other stakeholders in order to make a difference towards preventing all forms of malnutrition as well as reducing maternal and infant mortality. I hope this initiative will be sustained. I thank you very much for listening.
On behalf of the Honorable Minister of Health, Professor Isaac Folorunso Adewale, I present to you the symbol of the Breastfeeding Advocacy Initiative for your unveiling.
Thank you very much. It is my honor and privilege on behalf of Her Excellency, Mrs. Aisha Muhammadu Buhari, the wife of the President of the Federal Republic of Nigeria, to unveil this symbol as symbolic to the new initiative on breastfeeding in Nigeria. I'm happy I'm doing this on behalf of Her Excellency, the wife of the President, Strategy, National Social Behavior Change Communication Strategy for Infant and Young Child Feeding in Nigeria, 2016 to 2020. Thank you very much.
The wife of the President of Nigeria, Her Excellency, Mrs. Aisha Muhammadu Buhari.
Mothers, breastfeed your children. If you breastfeed your children, they will grow to be strong. They will grow to be a healthy nation. Mothers, breastfeed your children.
This program was put together by the Future Assured program of the First Lady, Her Excellency, Mrs. Aisha Muhammadu Buhari, to make sensitization for women, men, and the nation as a whole concerning the benefits of breastfeeding and the need to exclusively breastfeed the baby from the time he is born up to 6 months old. And thereafter, the baby should still be breastfed up to 2 years old. Breastfeeding has been shown to be very beneficial, not only to the baby, but to the mother. To the baby, it's the first immunization that the baby will have, because that first milk, what we call the colostrum, offers a lot of antibodies that is acquired from the mother to the child, thereby protecting the child from diarrheal diseases, upper respiratory tract infections, and several others. And it also encourages bonding, love between the mother and a child. Then for the woman, it prevents her from having cancers like ovarian cancers, breast cancers, and also offers, if it is done at 6 months old, for 6 months, it offers a temporary method of family planning for the mother.
You know, when a woman delivers, the abdomen is big, the uterus is big, but as the child is sucking the breast, there is contraction on the uterus, and this will help the uterus to return back to its pre-gravid stage. So we are sensitizing women to be aware that this will help to return back the placenta to its place, the uterus to its place, and also help in family planning. If you exclusively breastfeed for 6 months, you discover that even if you don't go for family planning, you will not be pregnant. So that is one of the aspects of exclusive breastfeeding.
Also, I think it's a great outreach because it's in a strategic location, which is a market area where you find a common man And I think they're very much excited because they're not used to seeing these kind of outreaches. So I think Future Assured has done a great job, and they should be doing more of this in the near future.
Now let's go to the health segment.
World Breastfeeding Week is celebrated every year from 1st to 7th August to encourage breastfeeding and improve the health of babies around the world. It commemorates the Innocenti Declaration signed in August 1990 by government policymakers, WHO, UNICEF, and other organizations to protect, promote, and support breastfeeding. Future Assured yearly joins the Federal Ministry of Health and other partners to mark the World Breastfeeding Week. Nigeria has the poorest exclusive breastfeeding rates in Africa, with about 25% of children having stunted growth. Breastfeeding is the best way to provide infants with the nutrients they need. WHO recommends exclusive breastfeeding starting within 1 hour after birth until a baby is 6 months old. Nutritious complementary foods should then be added while continuing to breastfeed for up to 2 years or beyond. This year, WHO is working with UNICEF and partners to promote the importance of helping mothers breastfeed their babies within that crucial first hour of life. Skin-to-skin contact, along with suckling at the breast, stimulates the production of breast milk, including colostrum, also called the baby's first vaccine, which is extremely rich in nutrients and antibodies.
That's it on Future Assured Half Hour this week. I do hope you enjoyed today's episode. I am Fatima Dongogo. Do join us once again next week for another informative episode of Future Assured Half Hour.
You are watching NTA, Nigerian television.